Welcome to Pasaydan Medical Coding Institute. Today we are going to discuss about the CPT modifier. Okay, we are segregating the modifiers based upon their uses. In that, general and service related modifier, anesthesia and surgical participation. The third one is team based or special surgical situation, and rehab and multiple use. We segregate into four different types so you can understand better way. So the first part in the general and service related modifier. In that 22, increase procedural services. So increase procedural service means the service is increased in terms of time, effort and work. So if the service is increased with the time, effort and work, so we have to give 22 modifier. Okay, the next 23, unusual anesthesia, when there is a no need of anesthesia or local anesthesia, but in due to some circumstances we are using the general anesthesia or local anesthesia. Okay, due to some circumstances we give the unusual anesthesia. Okay, in word itself it is showing you the unusual, it is not usually required, but we are giving the anesthesia. In that cases we have to give 23 modifier. Okay, and this modifier only goes with the anesthesia CPT codes. Next is 24, unrelated ENM during the post-operative period. Means the surgery is done and patient is on post-operative period, and now patient is coming for another problem. In that cases the provider is done ENM service. Okay, so in that cases we have to use 24 modifier to give the unrelated ENM service during the post-operative period. Next is 25, significant separately identified ENM on the same day. 25, for the significant separate identifier ENM service on the same date. It means on the same day if different ENM service is provided, so we have to give 25 modifier. Okay, so 25 modifier majorly we use for the three different scenario. First scenario is outpatient ENM service and inpatient ENM service is done on the same day. We have to give the 25 modifier for the office visit. Okay, for the outpatient. Next scenario is if ENM service is done and another CPT is also is there. So in that cases we have to give 25 modified to the ENM code. And third scenario is if minor surgery is planned. Okay, so minor surgery is planned, in that cases we have to give 25 modified. 26, professional component. These professional components means if provider is interpretation only. Okay, when provider is giving interpretation only, it is not performing the test. Okay, not reviewing or not ordering the test, it's just interpretation. Okay, just read and analyze what the content is saying. Okay, in that cases we have to give 26 modifier for the professional component. Next is 22, mandated service. These services are mandated by the third party, insurance company or court. In that cases, we have to give 22 modifier for the mandated service. This service is uh, compulsory. We have to perform that. So the provider is giving the services, and in our exam also they clearly mention that this services is mandated and we perform that. In that cases we have to give 22 modifier. 33 modifier for the preventive services. Okay, any services given to prevent any disease condition or any uh, further consequences. In that cases we have to give 33 modifier. The next part is anesthesia and surgical participation. 47, anesthesia by the surgeon. When anesthesiologist is not giving the anesthesia or in the absence of anesthesiologist, surgeon is giving the anesthesia. In that cases we have to give 47 modifier for the anesthesia by the surgeon. Bilateral procedure means the procedure is done on the both side of the body. Okay, right and left. For the both side of body we have to give 50 modifier for the bilateral procedure. Okay, here is the catch. If code description contain the bilateral, okay, we have the CPT code for the bilateral code, so in that cases don't need to append the 50 modifier. Okay, those CPT does not have the laterality. In that cases we can use the 50 modifier. Okay, so remember this point. So if CPT contain the bilateral code, so we does not need to apply the 50 modifier. Next, 57 multiple procedure. Okay, multiple procedure name itself is showing the multiple procedure is done on the same surgery. Okay, in that cases we have to give 57 modifier. Reduce services, the service is reduced. Okay, for example, we want 3 HbA1c value to determine the patient is diabetic or not. In that cases, provider order the 3 lab tests HbA1c value, and within the 2 report, provider got the conclusion the patient is normal or not diabetic, so that reduce the third one test. Okay, so in that cases we give the reduced services. The difference is between the reduced services and discontinued procedure is here is the service is reduced. Okay, and discontinue. Next is 53 modifier discontinue procedure. In that cases procedure means surgery is discontinued due to another circumstances. Okay, for example, the patient is not responding properly, or he is having the unconsciousness or excessive loss of bleeding. Okay, and patient is not getting the proper anesthesia. Due to any circumstances, the surgery is reduced. Okay, or surgery is discontinued or stop, we have to give 53 modifier. Okay, lots of time the coders are get confused in 52 and 53. The major difference is in the 53 the procedure is discontinued. Okay, the procedure is stop, and 52 reduce services, the service is reduced. Okay, so major difference is there, so be cautious about that and read properly so you can analyze better way. 54 modifier surgical care only. In that cases, provider is giving the surgical care only. It is not giving the pre-operative or post-operative service. Okay, only giving the surgical care. If, for example, if provider giving the surgical care only and another provider is performing the pre-operative or post-operative care, in that cases we have to give 54 modifier. Okay. Next is 56 modifier post-operative management only. Similarly, surgical care only, it means only surgical care means what time of in the time of surgery, what type of care is required, provider is giving only that care. And another physician when the performing the post-operative management, so we have to give 56 modifier. Okay, I think you understood better. 57 decision for the surgery. In the ENM's performance, if the provider is taking the decision to do the surgery on same day or next day, in that cases we have to give decision for the surgery, and this 57 modifier only goes with the major surgery. When the surgery is minor, we have to give 25 modifier. Okay, so if the decision for the surgery done in the ENM service on the same day or next day, for the major surgery we have to give 57 modifier, and for the minor surgery we have to give 25 modifier. Next is 59 stage or related procedure. Okay, so in that cases stage or related procedure means the discontinued surgery, okay, discontinued procedure is planned, okay, in next visit. So we have to give 59 modifier for the stage or related procedure means in the previous session the procedure might be discontinued or planned for the next session. Okay, for example, biopsy is done, and on the basis of biopsy a patient got the cancer. Okay, malignant cancer. In that first surgery they plan to remove the cancerous part. Okay, and in they check the what type of growth they are showing, how tremendous growth is going on. So based upon that, the next in the next session provider is remove that complete organ. Okay, so in that cases we have to give stage or related procedure. 80 assistant surgeon. Okay, when minimum assistant is given by the surgeon, okay, to the another surgeon. Okay, if two surgeon is performing, one is just giving the assistant to the another surgeon, in that cases we have to give 80 modifier, and 82 modifier for the assistant surgeon, which gives the maximum services or in absence of surgeon. Okay, in absence of main surgeon, if assistant surgeon is performing, in that cases we